The following segment is presented by Bremo Pharmacy.
And now we're going to talk about ways to help seniors live in their homes independently as long as they are able to. And here to tell us more is Jennifer Helmke of Bremo Pharmacy. Thank you so much for joining us.
Thank you for having me.
Now, Jennifer, you don't always think of your pharmacist as helping you to have home health aids to help you live at home, but you guys have an array of products out there. Tell us about what's beyond that pharmacist counter that people can go to you for.
Absolutely. So at our pharmacy, we want to look at the whole picture, the whole patient, and make sure they feel comfortable living in their home. And that may be that they need assistance with a cane or a walker because they're a little bit unstable. We first check their medicines to make sure that those are not the cause and increasing their risk of falls. After we've determined that, we'll check for a cane or a walker, and we have walkers and canes that have nice cool prints on them to keep them stylish at their older age. And we also help patients understand how to appropriately use them and safely use them in their home, such as avoiding tripping hazards, removing rugs, removing cords, and making sure the paths are wide enough for those walkers to move through.
Yes, because a lot of the homes here in Richmond, they're older, and when you think about people living into their 90s, some of these older homes are just not set up for that. So things like this, I mean, a grabber for those way high up or low places?
Absolutely. So patients can use this from a sitting position. It extends out so they can grab things high to avoid having to use a step stool, or they can also grab low to make sure they're not leaning over and falling over.
I think that's great. And you also have some tools for people who have suffered a stroke.
Absolutely. So patients who've had a stroke, most of the time they'll go to a little bit of rehab and work with the occupational therapist. And they are working with tools at that therapist's office that they may not have at home. We have those supplies. This is a spoon gripper or a utensil gripper to kind of widen the grip on a small spoon. You can add this. It's easier to hold in the hand.
Now, what about people with arthritis?
Patients with arthritis, it's a little bit difficult to grab small objects and turn small objects, such as a key. We have a key turner that you can add to the key to make it just a little bit bigger for you to be able to turn the key.
I think that's so important because I have an aunt who suffers from arthritis, and she, little things like putting on jewelry and you know, just squeezing her hands together to do things around. These items are really lifesavers for older adults out there. Thank you so much for coming in. And I'm just thinking, just as we baby-proof a house, we need to senior-proof a house to help seniors live longer and safer at home.
Absolutely.
So thanks for coming in.
Thank you.
And if you would like to find out more information about any of the items we discussed here today, just visit their website at bremorx.com.